So Bo's heart disease starts with his family. His father had hypertension. He was a firefighter, and he died of a stroke at 55. And so Bo began his life with probably a genetic underpinning that was unfavorable. He didn't really know he had heart disease until right before the Rose Bowl at the end of the '69 season, when he was running back and forth. He used to do these sideline drills where he was sort of teaching the players how to cut. He started getting chest tightness, and he thought it was odd, but he didn't really say anything. And of course, that was the team that beat the Buckeyes in what is called the biggest upset, certainly in Michigan football tradition, because they were undefeated. They'd been number one the year before, and nobody thought they could be beaten. Woody said it was his best team ever, and then we beat him. So at the Rose Bowl, Bo started having chest tightness and ended up having a heart attack and got admitted to the hospital in Los Angeles and missed that Rose Bowl. Now, if you think about it, 1970, we didn't have a lot to treat these patients with. We had aspirin. Everything else we have today. Bypass was just beginning. He spent 6 weeks in the hospital. He spent 3 months at his home. He recruited from his bed that year. And he started getting, he was fine. He had a significant heart attack, but he survived it, and he was going to be able to coach. But in a fairly short period of time, probably 5 years, he started having worse symptoms. And he ended up needing a bypass. So really, coronary artery surgery was early in terms of therapies compared to what we have now. Those bypasses lasted just 11 years, and they all closed. And he needed a second bypass. That was the bad news. He needed a second bypass. The good news is that we learned in that period of time that the mammary arteries are much better for bypass material than veins. Studies had shown that if you can use mammary arteries, they last. And so Dr. Otto Gago did 2 mammary arteries on Bo, and those allowed him to get through that second operation. And then remarkably, the preventive side and the medical side of coronary management started happening. So we got cholesterol-lowering therapy. When I looked at Bo's records, his first recorded cholesterol was 350. And it was untreated for years because there was no treatment. Statins came along, and by the time he passed, his cholesterol was 150. Then more effective blood pressure medicines came along, and he developed diabetes, and more effective diabetes therapies came along. Many people don't know that Bo, late in his life, injected himself 3 times a day with insulin. He would be at a lecture taking his blood sugar under the table and reading it, and then taking a pen out and giving himself an injection through his shirt while he was giving a lecture. He didn't want anybody to know. It was fascinating. He had very difficult to control hypertension, but a series of different classes of antihypertensive came along from research. And so by the time he died, he was on 5 different classes of antihypertensives, and his blood pressure was perfectly controlled. He developed complications from his heart disease. He had an arrhythmia. He thought his life was over. He was having severe shortness of breath. And we flew him up here and discovered that he had a rhythm called atrial flutter. And Dr. Marotti ablated it, and he was rolling again. 2 years later, he was really in trouble. He was very tired, exhausted, short of breath. Well, his heart had slowed down. Now he needed a pacemaker. He got a pacemaker, and off he went again. And then his heart started to fail worse, and he was having dangerous arrhythmias, and we put in a defibrillator. And then he got worse, and we put in a biventricular pacemaker. And so, in one man's life, over 40 years, he saw literally a dozen or more advances stemming from research, then applied to humans, then applied to his condition. So he ended up, what you would have thought, if a guy's 39 with a heart attack, in 1969, you'd say, lucky if he lives 5 to 10 years. And he lived almost 40. Just when he needed it, here it came. It was remarkable. I mean, I've never had a person in my practice who in a single life captured that full imagination of how research can change your chances. And he just got used to it. You know, toward the end of his life, we both knew things were coming to an end. And he just assumed that stem cells would be there, and he could come in and get some injections of stem cells in his heart and grow a new heart muscle, and he'd be off again. And, you know, that is a reality we'll get to someday. Unfortunately, we didn't get to it when he was still alive. So that's a brief survey of how research and Bosch and Beckler are ultimately tied together. Amazing.